Pakistan is the 5th most populous country in the world, and the city of Karachi accounts for the largest share of its population. It is here, in the heart of Karachi, where the Aga Khan University Hospital, Pakistan is located. AKUH is a private, not-for-profit tertiary care hospital that serves millions of people, not just within but also outside the city through its outreach health network. In late 2019, the global healthcare landscape was about to change.
We didn't even know what it meant. This was just another infection in a place far away from us. We didn't know what the symptomatology was going to be. We didn't know what the right treatment was.
We did not know if it's going to come as well. So it was not a when, it was more of an if it's going to come.
Infection control already has a process where we identify the global epidemics, and this was also identified in 2019.
We had a collaborative exercise, a tabletop exercise with Johns Hopkins Hospital, where we started planning for pandemics in case the pandemic would come.
The other hospital in the city always look at us as far as nursing training is concerned and the best practices implementation. So we provided the training to the nurses of other hospital how to deal with the COVID patients.
We had set up a command center, which we call the COVID command.
It was a multidisciplinary group, and they were meeting on a daily basis during that pandemic initially, and then they continued to tweak our plan and response wherever it was required, and that actually helped us taking right decision at the right time.
I remember February 26th, that young boy, and it was like, okay, that one was positive, great.
अहम खबर से आपको आगाह करें, कराची में कोरोना वायरस का पहला केस सामने आ गया है.
All right, now we're in it. We are in it.
There was a lot of fear amongst the nursing staff, amongst the doctors as well, taking care that they may get infected.
They were in the front line and they were worried that whether the institution has thought about them or not. So we used to go to them and teach them how to don and doff.
Remember, the one thing which was very, very clear is safety of our staff was primary.
One of the biggest things that the university did was come in with very employee-friendly policies. The fact that you could get free access to care, free access to testing and assessment, not just for yourself but also for your dependents if God forbid somebody got COVID.
People were asked to stay home and essentially stay away from the pandemic, whereas we as doctors, nurses and other healthcare workers, we went towards the pandemic to face it head on.
So being the responsible department managing the supply chain operations of healthcare institution and supporting the frontline workers, our responsibility was to handle those challenges. And I recall in few cases the prices were increased up to 500%. Buying those important PPEs, critical supplies, medications, food supplies.
How do each one of us remember in our day-to-day life whether we are safe enough to come into work, whether we're feeling well enough to come into work? So we started by creating something that we call a Sehat Check app. It's a very small little program looking at the most common symptom that somebody with COVID could have.
For safety of patients' families, we will not allow patients' families to come inside the COVID ward. When a patient comes with COVID, the doctor and the nurse is all the patient has. So we are treating them not just physically and not just their disease, we are also treating them mentally. We are their families.
So my biggest challenge was to take care of my nurses and their well-being, physically as well as emotionally, because this infection was completely new for them.
So there were many battles that we were fighting on multiple fronts. Once the COVID lockdowns were lifted is when we started seeing the impact of it on our regular patient flow.
the fear of the virus was so much that patients did not want to come.
And we started doing research. We had focus groups, we had surveys, we had discussions, informal, formal, to understand what was happening. All that information, that knowledge helped us then respond to it. Our messaging changed. So for the longest time, for several months, we ran a campaign on choose safe care, don't delay. Reminding them that delaying care is not an option because there are other diseases that are causing harm. And through this, we were successful in increasing occupancy by 30 percentage points.
There were committees working and coordinating with other countries like in Afghanistan, in Syria, in Kenya, in Tajikistan, in many other parts of the world where AKU or Acadian entities were actually working. So we were coordinating and collaborating very well, learning from each other's experiences and responding to the COVID situations in respective countries.
One day, we got a call from government officials that the vaccines are arriving and that we will be the only private hospital in the entire country to participate in a public vaccination campaign. We received the first tranche of vaccines. I still remember it. We came in a cooler and I literally opened it and took it out of the box and held it just to see that, okay, it is real, the vaccines are here.
As of now, almost all our staff and students are vaccinated against COVID.
We saw the power of people. We saw the enthusiasm, how self gets a lower priority over the greater good.
Honestly speaking, life, I think this pandemic has taught not the nurses, but I think everyone about the importance and the value of the life.